Hi, nice to meet you all. My name is Dr. Ragavan. I am a Uro-Oncologist. I am a specialist in urological cancers. Hi viewers, today we are going to talk about erectile dysfunction, the most hotly discussed topic in a closed room or in the pub or in the bar, but is hardly discussed outside that. What is erectile dysfunction? Inability to have a proper erection, which is important for completing a penetrative sexual intercourse. Is it important? We talk about physical health, we talk about mental health. I always tell patients and public that sexual health is as important as physical and mental health. It is part and parcel of being a human being or a living being for that matter. Erection will start happening once you hit puberty, and as we grow old, men loses erection with time. It's not that erections will be infinitely maintained well. So I always explain that the erection in a 20-year-old is much stronger than a 30 whose is stronger than 40, and so on and so forth. At about 60 years of age, 60% of patients will have erectile dysfunction. In order to help them to get treated with it, we need to understand the problems with erectile dysfunction. Once you don't have a proper erection, you will not be able to complete a penetrative sexual intercourse, which leaves you dissatisfied for both you and your partner. And hence, making sure that you have adequate sexual health is an important component of the well-being of human beings. Why does erectile dysfunction happen? The most important reason is aging. The second important component, especially in younger patients, is anxiety. We call it psychogenic erectile dysfunction. What is the most important component of psychogenic erectile dysfunction? It is called performance anxiety. People think that they have to perform as seen in a pornographic video or elsewhere, and they think they'll be able to sustain erection for that length of a time, which is a mythology, and therefore they feel inadequate. And as a doctor, my most important job is to reassure patients and tell them what is actually possible physiologically by a human being. Most of the men will have decent erection, which will be with which he will be able to complete a penetrative intercourse, and once penetrated, the erection will last for a maximum period of 1.5 minutes. So if you are within that limit, you are fine as a human being. The next important reason why erectile dysfunction happen, as I said, age and psychogenic factors. The other factors includes diabetes and cardiovascular disease. What is it that diabetes and cardiovascular disease has to do with erection? It's the same principle. It is called small vessel disease. The small blood vessel that supply the male organ gets damaged, similar to the diabetes that is damaging the kidney or the heart as well. And that causes erectile dysfunction. So many times when a patient, a new 40-year-old, asks me about erectile dysfunction, I always test the diabetic status and the cardiovascular status, making sure the heart is working well. Okay, now that we have a problem and you are not able to sustain an erection, how to treat it? Treatment is simple. As I said, the first thing is to make sure that your heart, your sugars are all okay, and once that is assured, you can be started on a simple medication under doctor supervision and monitoring to ensure that you get quality erections. In some patients, we may have to do a lot of psychogenic counseling in order to bring their expectation to normal level. Expectation at high level is an important component of erectile dysfunction as well. If a patient is not able to sustain the tablets or fails the tablets, and that is a very small number of patients, they can be helped with a surgical intervention, which is called penile implant. Though it is costly, it gives good results. But penile implant is always left at the last stage. So viewers, erectile dysfunction is a common problem. Most important component is psychogenic. Reassurances about what is normal and expectation should be explained to the patient. Make sure that the heart and the sugars are tested well, and simple drug therapy and reassurance will do well for them. Have a good day.